Hello and welcome to Fit to Speak. I'm Eugene Obah. So glad to have you with us. It's been a year since the insurrection, 1 year since U.S. President Joe Biden took office, 2 years since the first case of the novel coronavirus was discovered in the United States, and a long while since former and twice impeached U.S. President Donald Trump said something that actually makes sense. I'll have more on what he said at the end of the show, but with the Omicron variant still with us and with the challenges of testing coming into focus, I speak with Dr. Panagis Galiatsatos about all of that and a lot more in a few minutes. But first, I'd like to wish all of you a very belated Happy New Year, and I am incredibly excited to be beginning our third season of monthly shows, which of course you can see right here on this YouTube channel, youtube.com/the channel. And do me a favor, click the subscribe button and ring the bell so that you do not miss any of our episodes and the exciting content that this division and our entertainment division are going to cook up for you later this year. I was also quite happy to see Nickelodeon's telecast of the 49ers Cowboys wildcard game, which for the second year in a row was incredibly successful and truly delightful, except probably for Cowboys fans whose only Super Bowl hopes lie in VHS tapes. I know, I'm so original. Oh, and speaking of relics, at the officially unofficial retirement party of Pittsburgh Steelers quarterback Ben Roethlisberger that I was invited to by the kind folks of the Kansas City Chiefs, Patrick Mahomes and company sent him off with a loss. But the biggest loser, in my view, has been much of the sports media. You see, when it comes to talking about Big Ben's behavior off the field, especially in terms of the evaluation of his legacy, it has been. There was a notable exception in ESPN's Monday Night Football coverage earlier this month, but Ben's transgressions were chalked up to mistakes and immaturity by Brian Grease, which garnered quite a bit of backlash. I'll get to the far more serious allegations in a minute, but remember that Big Ben crashed into another car while riding a motorcycle without a helmet, and doing so again after his accident, even though he said that he'd wear one. Although it should be noted that Pennsylvania's law mandating helmets was repealed nearly 20 years ago. Not to mention that he was accused of sexual assault twice. It should be noted that though none of the allegations ended up in criminal charges and the 2009 allegation was settled out of court, the NFL did suspend the quarterback for initially 6, but later 4 games under the league's personal conduct policy. It doesn't take many brain cells to know that most mainstream outlets, especially most mainstream sports outlets, are very cozy with the leagues that they cover. And there's a prime example of this. In the early years of Big Ben's time with the Steelers, that I'm going to be pointing out exclusively on our Instagram page. We are at CSE_media, and I want you to make sure to check that out once the video drops. But the point I make here in even bringing all of this stuff up is that the athletes need to be covered by the media in their totality. They really need to. And the hope is that the next 5 years, 10 years, 15 years from now, once all the dust kind of sort of settles, let us hope that the media, when it comes to bringing up Ben's past, will have the same energy that they do for other athletes, especially when it comes to people like Michael Vick, who to this day gets a lot of stick about his dogfighting ring, including this rather snide aside from Green Matters. And let's be clear, what he did was completely and utterly wrong. It really was dogfighting. I don't think there's anybody out there that would say that what he did was correct or right. So, the stuff is completely and utterly wrong. But I dare say that some black athletes, get very, very, very different treatment. This is very, very different treatment than what Michael Vick has got, especially given that he served time in federal prison and became an advocate for animal rights in the years that followed. If Big Ben were black and did all of these things, including this, do you think he'd be in the NFL? I think we know the answer to that one. I acknowledge that people are allowed to grow, provided that they do so in good faith. And the hope is that Big Ben, who is pushing 40, I have very little doubt that somebody like him now is not the Sports Illustrated portrayal that he was when he was in his 20s. But as with all things in life, especially with the NFL, we truly have a tale of two Americas, with some people given more grace and room to fail than others. And that, my friends, is something that is certainly not worth celebrating. What is worth celebrating is the fact that nobody in Australia, not even tennis superstar Novak Djokovic, are above the law as he was deported. His visa was revoked as a result of him not being vaccinated. He was to have competed in the Australian Open, but the government shut the door on that. A very good thing, considering that he, even by his own admission, flouted COVID rules and showed up to an interview while knowingly contracting COVID. Djokovic is a four-letter word that I'd use if we replaced the second O in his surname with another vowel. There are other words I'd use for him, but this is a family program. But seriously, I do have a message for Novak, and that is, Novak, you are a complete fool. You are a complete embarrassment to the world. And real champions do not behave the way that you did. And just like Big Ben, your legacy is colored as far as I'm concerned. And through your actions, you are not a champion. You are a chump. And I hope that the door did not hit you on the way out. Oh, you thought I was done? I'm not, but Aaron Rodgers certainly is, as he and the Green Bay Packers lost in epic fashion to the San Francisco 49ers in the divisional round of the NFL playoffs. No word on whether or not podcast host and UFC commentator Joe Rogan supplied Rodgers with enough ivermectin to perform on the night, but in all seriousness, the Schadenfreude was epic, especially on the Twitter sphere. Why? Because throughout the soon-to-be completed season, he lied about his vaccination status, contracted COVID, and spent way too much time on things not pertaining to football. He should have been spending more time practicing at Lambeau Field than practicing Fox News and GOP talking points. One and the same, really, and wasting 28 minutes on ESPN bleating on about being silenced and canceled. The irony. Since Aaron and that broken toe of his will be immunized from appearing at this year's Super Bowl, he will have a lot more time to mull over his future, do his research, and leap to the conclusion to take an injection or free of reality. And joining me now is Dr. Panagis Galiatsatos. Among so many things in the health profession, he's a pulmonary and critical care physician at Johns Hopkins. He's also an assistant professor in the Division of Pulmonary and Critical Care Medicine, the co-chair of Health Equity at the Johns Hopkins Medicine Office of Diversity, Inclusion, and Health Equity, and he's the co-director of medicine for the Greater Good. Doctor, welcome to the program. It is great to have you on. And let's go ahead.
Yeah, I know it's an honor to be here. It's a day off, so rather casual today. Hopefully that's okay.
Oh, that is perfectly fine. And that is perfectly fine, Dr. Galiatsatos, especially given the weather that we have been experiencing here in the DMV, and especially as of the time of this recording. Let it snow, let it snow, let it snow. But let's go ahead and deal with this other thing that we've got going on here. It's the Omicron variant. We've been dealing with it now for the past 2 months. And, we've been setting records in the US. And one of the things that I want to play for our viewers is a soundbite from acting FDA Commissioner Janet Woodcock, which I think kind of sort of furthers what's going on. And here it is.
I don't think prior approaches reflect what's going on right now. I think it's hard to process what's actually happening right now, which is most people are going to get COVID.
That is a pretty stark revelation that, we're going to have a lot of people getting COVID, especially with this variant. And there seems to be a school of thought from some folks that, if everybody is to get COVID now and that sort of thing, then, somehow this will somehow go away, if not get closer and closer to becoming endemic, really.
Yeah.
So respond to that sentiment if you can, and what is factored into these increased numbers?
Yeah, so one of the things that I'm hoping came from that statement was more of a recognition that yes, it's very contagious, rather than because I think some people just interpret it as throw in the flag, you are going to get it. I really don't hope people feel that way in the latter. I still want people to be as cautious as possible to not get the infection. Of course, be well vaccinated, because if you do that way, you can fight it off. But the reason I still emphasize caution is, it can do a lot of complications. Two, it can still find people for you to transmit who are unvaccinated. And three, one that's very important to me, because once a week I dedicate my time to the patients with post-COVID syndrome, right? So you can only get post-COVID if you've gotten COVID. So you really, really want to be cautious of that. And I know Omicron is very contagious, but please don't hear those words and think and throw in the towel. She's just recognizing this is a David and Goliath battle. David still beat Goliath, and we can still beat Omicron. What's making Omicron just do what it's doing? It's two things. One is it had the genetic potential to be more transmittable, more contagious, and we gave it the opportunities to do that, right? We had the holidays, we have some post-COVID, not post-COVID, or during COVID pandemic fatigue, right? So our guard gets let down, our holidays gatherings. And I see this because I had a close encounter with a family member who said, oh my gosh, I tested positive a day after you and I saw each other, literally for about 10 minutes, face mask down, to kind of just talk. So I get it. The fatigue, the holidays, and a contagious variant all have come together for a perfect storm. So that's from my standpoint. With that said, I still emphasize the caution to not get it. Do our best, and no stigma or judgment if someone does get it. But what I emphasize are 3 points. Don't get it, don't spread it to others. And if you do catch it, do our best with the vaccines in order to create COVID into a minor cold. So I don't think this catching it all is what's going to gear us into kind of an ending of the pandemic. I think honestly, from my standpoint, the way the ending of the pandemic even looks is if we can make COVID less disruptive on our lives, less disruptive on the healthcare system, specifically inpatient hospitalizations. We'll get there with strategic face masking, testing, and vaccination, right? With our antibodies that we get from the vaccine, we're forcing the virus to become a cold, and not to mitigate anything from that. Colds can be bad, trust me, but they're not rendering you into the hospital, and they're not putting you on, life threat or life support. So, from my standpoint, the way the pandemic ends is because we will force Mother Nature's hand at it.
Those are very, very important points, and especially what you've just said, even earlier with the long COVID, which doesn't even get talked about much, if at all, really. And you touched on an important point about testing, and I definitely want to get to the importance of testing here. How important is that accessibility, especially to everybody?
Well, yeah, I mean, this is where, I have a sit down with colleagues or other individuals, and I make it, from my standpoint, science will never stop, keep doing science and so forth, but we got science, meaning we have the scientific outcomes we need to end this pandemic, right? The barriers right now moving forward are just man-made, right? From misinformation to accessibility, right? That's what's preventing this. If we could get these tools out to everyone, testing specifically, what testing allows is peace of mind to continue doing the right thing, to go out. Or the other part, because on a side note, someone made the point, well, if you feel germ, you shouldn't just stay at home. I was like, yeah, that would be ideal. Have you met Americans? They still go to work, sick as stinks. So, but the testing allows us to see who has it and who doesn't. And it also allows us to do really adequate contact tracing. This past week, my 3-year-old school had a few outbreaks of COVID. And when we realized those were community spreads, not internally school spreading, and we could do that with the testing in order to emphasize that. So testing, from my standpoint, there's 3 tools to end this pandemic: the face masks, proper ones; testing, accessible ones; and vaccines, accessible ones globally. You have these 3, then suddenly we've turned this beast into nothing more than a common cold that we can assimilate with, and we move on with our lives. So yeah, testing, I think, is one of the key strategies to helping us end the pandemic.
And we are seeing a lot of more testing centers open now, on the back of the fact that, yes, we're still dealing with this, but then also we've had also some issues as well. Of course, Right now, as of the time of this recording, trying to find the at-home tests is very hard to come by. Now, Americans can order tests for the U.S. government, and that is over at covidtest.gov. I encourage all of our viewers to check that out. In thinking about the issues, though, in terms of, like, say, the long lines, even myself, I had a test recently that came back inconclusive. But what do we do about some of these issues? How do we address some of the issues with the lines and things of that nature that people are experiencing at this time? And the fact that, of course, until now, people have not been able to find either at-home tests or that sort of thing.
Yeah, no, I mean, again, we have to realize, health, here in the United States, right, we have some of the best institutions, if not the best institutions of medicine and science. We get the outcomes that people would desire. Now it's the accessibility issues. And the entire time with this pandemic, especially early on, we saw health disparities really at its worst. They're still there. They haven't gone away. Again, this speaks to my frustration with the health equity conversations. They get pulled up and it seems more of like a nice moment in time to discuss them without ever transitioning into a movement. I say this because, as you mentioned, the hot product has always been recently these test kits. You know who's struggling to get them? People still disproportionately impacted by the pandemic can't find them. And they're the ones still being ravaged. They're the ones still being asked to come into work and do the work that no one else wants to do. And we can't get them to tests. It is an ethical reckoning that we really need to understand and face and never have happen again. And I'm saying this because that's what we thought was going to happen a year ago. The COVID silver lining, this could be the catalyst. No, it still hasn't been. So from my standpoint, as a physician, as a scientist, it's frustrating, right? Because we got this, we got it here. Now we need the man-made barriers to be removed. Like my other frustration, I apologize for the way this sounds, but just seems we're playing catch up. Like who didn't have the foresight? When Omicron came out and it was late November or sometime mid-November, and we're like, okay, well, we all have a calendar. We know the holidays are coming up. And you're telling us a much more contagious variant. Come on now, let's get tests out there. Let's do it. That's the part. We're right around mid-January now. It's great they're getting it out. Don't get me wrong. That's great. It's better late than never, I guess. But you really got to sit back and say, what took us so long? Everyone could have predicted this, and those predictions. When as a physician, you prepare for the worst, you hope for the best. But you don't play catch up if you prepare for the worst. So it's a little bit frustrating, and the other part to all of this is the mental health consequences that come on this. I mean, I have my own patients who are living with this anxiety and fear because they don't here's one thing the test provides aside from the pandemic and so forth, provides you a sense of control, right? In this time of the pandemic, we've lost that. We don't know what the heck is going on. The test allows that a little bit of peace of mind, even if the test can be difficult to interpret and inconclusive, but it still puts it in your control. And I say this because that microcosm of control can do some level of mitigation towards the anxiety people are having. You've taken that away or you've made it inaccessible. So you have this heightened mental health consequences that are happening in the pandemic that, again, we could have prevented. So that's why I'm hoping in the near future, such access to healthcare, especially the products we need in the pandemic, are there. That way we can help people just live with their lives. Otherwise, we are the ones creating the man-made barriers now.
It's become a cumulative effect, hasn't it? There's really been a cumulative effect. And I really especially liked what you said about the fact that right now we have essential workers. We've got minorities. We've got those of low income who they're not going to be, a lot of them, not everybody, but you're going to have a lot of people who can't afford to go on Amazon or go to the Rite Aid or CVS or whatever and pay $17 a test.
No, you're spot on. Yeah, I mean, the immigrant town that I grew up in, I mean, I went to the church or streamlined through the church, and they're just like, the amount of money it costs to buy a test, that's grocery money for the week. Like, come on, someone asked the great questions, like you had, and this is before the government, are going to now start giving them out. to some extent, right? But the other part is like, well, insurance will cover it. And someone's like, wait, do you know how hard it is to talk to insurance companies to find out how they're going to cover it? Like, we're creating this to make it so difficult for people who just want to do the right thing. If you make it hard to do the right thing, people won't do the right thing. And honestly, like, we make the vaccines free and accessible. Do the same thing with the tests, free and accessible. Free is key here. Free is key here. And the same thing with masks. I mean, everyone should be handed out. Get them to the grocery stores. Get them wherever like, you check out your bags. Here's a free test. Here's a free KN95. Move on with our lives. This is how we end it. This is how we end it. And otherwise, we're just spinning our wheels.
Most definitely, most definitely. And thinking about even from a policy perspective, from a public policy perspective, what, if anything, should the U.S. government, should even local governments like here in Maryland and across this region, should the governments be doing more?
Yeah, no, I 100%. And I do recognize, I'm a physician scientist. Unfortunately or fortunately, we've all kind of been pulled into the spotlight to weigh in on public health. And from my standpoint, what's bad for an economy? A pandemic. End it. Get us the free tests. Get us the free masks. The vaccines, I'm glad they're free and out there. Fantastic. Get the tools that we need to end it. At the same time, make sure you get people from the healthcare system going into the communities to messaging it. Otherwise, you don't. Because I say this because one of the questions in case this comes up is like thoughts on mandates. I don't know. Like, I mean, from my standpoint, if you're talking to a body of people who there's a friction between government and medicine and healthcare systems, mandates are just going to make that worse. And I say this because there's going to be a future pandemic, and we might be really planting seeds of friction that we'll never be able to overcome again. From my standpoint, however we choose to promote the vaccines and prevent death, you got to supplement it with medical messaging. Get people out there to have these conversations. Like, to me, that's the fourth key thing to ending this pandemic, is getting trust back into healthcare, reaffirming medicine as a public trust. And it only happens if we go out there and talk to them. Not to sound Christian-esque, but, there were disciples and apostles who went and discussed the gospel. The same thing. We got to go out there and discuss this. Like, we got to go out there and meet people where they're at and really emphasize what we need in order for the community to understand and win back their trust. So from my standpoint, that's what needs to happen. Last side note is the countries who can, right, from the US to Canada to the United Kingdom, you also need to discuss global vaccine equity. Because in a time of a pandemic, all we need is another mutation. Like, my biggest fear, and not just mine, by the way, others as well. You get the next variant that has the transmissibility of Omicron and the lethality of Delta. We're really sunk now. So we need, global equity to these vaccines. So, those are from a political standpoint. Think here, but think abroad to end this pandemic.
In thinking about all of this now, it has been 2 years since the first case of the novel coronavirus has entered the U.S. in Washington State. And, you've been at Hopkins. How has it been for you all over there and over this past 2 years? And what do you want our viewers to know?
Yeah, no, and thank you for that question. And it's I'm going to be personal through this. One of the things I think many of my colleagues and I have done, for instance, is making sure we get proper mental health access. The biggest breaking point for me during this pandemic happened actually probably within the first 6 months of the pandemic. What happened during those times, whether this made big news or not, but families weren't allowed to come into the hospital. And I'm an intensive care unit doc. I've seen people die. But the thing is, I've always done it in a way that's somewhat disconnected, right? I tell loved ones their loved one's going to die. They go into the room. They're there as they pass away. Then I go in and pronounce. There's a disconnect. And I need that disconnect in order to just be a human and keep doing my job. During the pandemic, those family members couldn't come in. And they made it clear. They're like, doc, you got to hold mom's hand. You got to hold dad's hand. You got to touch someone before they pass away. And so the amount of hands I held as they passed away, listening to their family on Zoom, scream and cry countless times, that broke me. And that's broken many of my other colleagues who wanted to just be a good human being. Like, how am I going to say no to a family asking me that? Broke us. And I say this because after that big wave of the first year, a good portion of us left. They left healthcare system. I don't know if they'll ever come back. And I'm not saying your seasoned doctor who was like 5 years from retiring. I'm talking about docs in their late 30s who are like, I'm done. Now with the second wave, it's the same impact. But this one just feels, I mean, there's a notion of betrayal to some extent, when we think this could have been prevented. Like, come on, like we're all doing our best. Because I say this because I love being a doctor, but I'm not a doctor. I'm a husband, I'm a father, I'm a son. Those are so important roles, but I can't even participate in them because I'm going to take care of situations that could have been preventable. So I really want people to recognize that, like you're breaking the healthcare system, right? That's key here. I mean, again, no stigma or judgment, but what I'm hoping everyone does is waking up every morning right now, since we're still in the pandemic, waking up every morning and just say, what role am I going to play to end the pandemic? Right? Because the pandemic is not going to end in a hospital. In the hospital, that's where I'm saving your life. That's not where I'm ending the pandemic. Where the pandemic ends is in your household. If you wake up and say, how am I not going to catch COVID? How am I not going to spread it to someone else? And if I do catch it, how do I just contain it to be a bad cold and not something life-threatening? If we all wake up asking ourselves that, and the answers are there, face masks, testing, vaccines. If we all wake up asking that question, I believe it's going to guide us to do the right thing, or else you're going to break us. And again, we aren't doctors and nurses. You can't look at us like that so you seem disconnected. We're your neighbors. We're family members. I just want to be a dad holding my daughter. That's what I want to do. I can't do that if our hospitals are overwhelmed. So, we'll step up, we'll help. But, don't forget, we're breaking as well. So that's the point I want to emphasize. And again, just to make it clear, the pandemic is not going to end in a hospital. It'll end in your household. We just need that sense of accountability amongst us all.
Absolutely. I think these are very, very wise words. And I know that, as you've pretty much enumerated, it has to be tough on everybody in the medical profession over these past 2 years. And it seems that again, the concern with all of these increased cases, it's just, again, the strain on the system, which I think there are some people who just don't get what is going on, because there are a lot of people, especially those who are against the vaccine, they're kind of like, what's the point? When they see these numbers and all that, it's like, what's the point and all of that.
Yeah,
Go ahead. Yeah, what do you have to say to that?
And that's why I really try to change the conversation. Because if we go down that rabbit hole of the vaccine conversation, no, let's take it back, my friend. What role are you going to play to end the pandemic? Right? What role are you going to play? You can't, anti-vaccine your way out of this. Ignorance is not a solution, right? If you're drowning in water, not believing in the water plays no role, right? Not believing in the virus, you don't get that opportunity. This isn't a religion, right? Mother Nature will do her thing. So the way I approach anyone who's anti-vaccine, I just take it back. What role are you playing to end this pandemic? Talk to me about that. Let me hear your thoughts. And then fantastic. If you're going to, dodge this like the Dickens, great, fantastic. Because I want some level of accountability. That's all I want. If that moves someone closer to getting a vaccine, because that's the way I think right now where you're at with your most refractory people towards this, you just got to try to find some ground to win over. That's what I'm saying about the accountability. And then from that standpoint, let them hopefully come to that conclusion on their own, right? Because intelligent people really have the capability of changing their minds. And I want to give humanity the benefit of the doubt. That's it. And by the way, that goes back to the fourth part, right? Medical messaging, getting us out there. Because those who are spreading misinformation don't take a day off. So we got to stay persistent and consistent to maintain that trust now and moving forward. So that's it. To everyone, again, you can't, ignorance is not your way out of this. You have to understand what role you can play to ending this pandemic.
That's the question that I think everybody watching this program should be asking themselves as they move forward in these next several months, next several years. People should ask that question, and I hope that people really think about this today and every day. So Dr. Panagis Galiatsatos of Johns Hopkins, thank you so much for joining me today.
Oh, what an honor! What an honor! And actually, I want to say something for you, good sir.
Yeah, absolutely.
Thank you. So, giving doctors and nurses this opportunity and this voice, I mean this. To your listeners and even the new ones, if we can convince some of them to kind of take on this accountability, then you, good sir, have saved more lives than any doctor or nurse ever could. So, thank you for that. Thank you for the opportunity.
I really do appreciate that, Dr. Galiatsatos. Thank you. Thank you. Folks, we continue to need your help in finding broadcast industry professional and University of Maryland alum Terrence Woods, who's been missing since October of 2018. If you have any information as to Terrence's whereabouts, you're asked to call the Idaho County Sheriff's Office at 208-983-1100. That's 208-983-1100. You can also reach out to us on our social media accounts, which you'll see at the end of the program, and we'll pass any information along to them. Finally, stop the prices, because something former U.S. President Donald Trump said actually makes sense, that politicians who do not answer the question of whether or not they got boosted, Florida Governor Ron DeSantis is a prime example, are gutless. Now, even though Trump's spokesperson said that he was not talking about DeSantis, I think smart people like you and I can read between the lines. Let me read this. This is from Trump himself, quote, "They don't want to say it because they're gutless. You got to say it whether you had it or not. Say it. But the fact is that I think the vaccine saved tens of millions throughout the world. I've had absolutely no side effects." He went on to say, if they get it, they're not going to hospitals for the most part and dying. Before it was a horror, and now they're not. Just goes to show you that the broken clock is right twice a day. And thank you so much for watching. Listen, there's going to be a lot more where that came from, so you better stay tuned to catch it all. In the meantime, don't forget to follow us on all of our social media accounts for more information, including all of the bonus content that you'll see from today's show. And don't forget to subscribe and ring the bell on our YouTube channel so that you do not miss any of our episodes. And until next time, I'm Eugene Obah. Remember, we will not be silenced.